Welcome back to Aesthetics Magazine. Find more skincare resources at aestheticsmagazine.com. In today's episode, we will be discussing hair removal. Hair removal skills, the removal of unwanted hair, which is often a primary focus of a skincare professional, requires a great deal of practice and skill. All states require that professionals use hair removal methods and equipment in accordance with the manufacturer's instructions. They also prescribe that the professional must be trained in the proper use of the devices and methods employed. Methods include shaving, chemical destruction of the hair shaft, extraction or tweezing, laser or photo destruction, and the various waxing or topical destruction methods, such as soft or hard wax. When using any type of hair removal method, the equipment and treatment room must be clean and properly disinfected. Single-use items, such as cotton for use in soft wax hair removal, must be discarded after use. Removing soft or hard wax from the skin, another type of hair removal, is termed a non-ablative procedure. That is, the surface of the skin is not deliberately destroyed, but rather, coagulating injury is localized and the hair is destroyed by the energy. Lasers and intense pulsed light sources are examples of hair removal equipment using the ablative process. Such instruments are capable of great harm, and thus many states set forth specific training requirements in the use of laser or intense pulse light apparatus for hair removal. Soft wax, often called pot wax, is removed with muslin or pellin strips. Hard wax, which is applied in a thick layer, does not require a strip for removal. Proprietary or trade secret names for the soft or hard waxes often used for hair removal may be found. Such waxes are usually classified as either a cosmetic, drug, or device under the Federal Food, Drug, and Cosmetic Act, and some states allow only licensed healthcare professionals to apply or remove such products. Mastering. The art of draping. Hair removal requires the esthetician to observe the client's privacy and to work methodically, as the drapes are repositioned to expose various body areas. To master the art of draping, the esthetician must learn how to drape effectively. Draping in the aesthetics industry refers to the technique of covering the client with linens and placing them in a way that only the treatment area is exposed. Different types of draping materials include sheets, towels, and blankets. The top linens are used to cover the client and must be properly secured to avoid embarrassing incidents. A large bath sheet or bath blanket can be used to cover the client completely. Small face towels or hand towels may be used to cover a portion of the body in smaller areas or to protect the linens from products or the client's feet. Terry cloth, which is a fabric with small absorbing loops, is the preferred material for draping because it is absorbent and not likely to fall when folded. To properly drape a client, the first step is ensuring that the client's privacy is maintained at all times. Secondly, the client's skin should not come into contact with any surface that is not covered with a clean linen. Thirdly, the esthetician should expose only the area of the body being treated at any one time. Finally, the top linens should never be ruffled and should be properly secured. The art of draping is important in the aesthetics industry not only to ensure that the client is treated in a professional manner, but also to avoid embarrassment for the client. The masterful use of draping materials can create an environment of relaxation and security for the client during hair removal services. The skills required for draping are an essential part of any aesthetics program. Precision tweezing, techniques, understanding the hair growth cycle, and how hair is removed. Each hair shaft grows from a follicle and passes through three main stages in the growth cycle: anagen, catagen, and telogen. Precision tweezing and waxing are temporary hair removal methods that only target the hair shaft during the anagen phase. Therefore, the hair needs to be at the right length in the growth cycle in order to create a successful desincrustation or pull the hair from the follicle. It is ideal to begin tweezing procedures after a close electric current has forced the hair in the follicle to the surface, or following a facial steaming treatment. This is because the hair shaft will be softer and more pliable, while the desquamation that takes place during these treatments will also make removing the hair a little easier. Care should be taken to ease the hair out in the direction of the hair growth and as close to the skin as possible. This prevents the hair from breaking and makes removal easier and less painful for the client. Tweezing can be used to remove hair from outside of the eyebrows, where the skin and hair is usually tougher, or to thin out the eyebrows, when the hair is required to be removed from the root. But the level of precision that can be achieved, as well as the skill and expense required for the treatment, has made hair removal using electrolysis a popular alternative in recent years. It is argued that electrolysis offers the dual benefit of being able to target very specific areas, as well as offering a permanent solution for hair removal, which tweezing or waxing does not. The use of high frequency is commonly used in both desincrustation as well as to promote a germicidal effect after tweezing, creating flawless eyebrow designs by always making sure that the client's features and decisions are prioritized. Therapists can ensure that they are creating the right brow for that client and will be able to find the most accurate technique for hair removal. Also, as a visual aid, the drawn-on brow plays as a safety net and is used as a reference to know which hairs should be removed and which should be left behind. This will significantly reduce the risks of mistakes. Next, the brush should be moved along from the nostril to the outer corner of the eye, and a mark should be placed on the brow bone. Then, to find out where the highest part of the arch should be, a brush should be placed across the pupil of the eye, and a mark placed on the brow. Finally, a line should be drawn from the tail of the brow to the mark, in order to create the perfect shape. First, a short eyebrow brush or a pencil is placed along the outer side of the client's nostril, from the edge of the nostril to the brow bone, to find out where the eyebrow should start. This point should then be marked using a makeup brush with a removable tail on the edge of the nostril, horizontally level with the top. In order to efficiently remove unwanted hair from the eyebrows, a method known as brow mapping should be used. This important pre-treatment procedure involves creating the brow and drawing it. This is done by marking the start, the end, the highest point of the arch, and the thickness of the brow, all in line with the client's facial features and shape. It's time to level up your skincare product expertise. Are you confident explaining vitamins A, C, and E to your clients? Stop guessing. Get the Essential Guide by Greg Risha, Understanding Vitamins and Skincare. Get your copy today at aestheticsmagazine.com.